Question number 1. What is the normal range of systolic blood pressure in adults? Your options are 80 to 120 mmHg, 120 to 140 mmHg, 140 to 160 mmHg, or 160 to 180 mmHg. The correct answer is A, that is 80 to 120 mmHg. The normal systolic blood pressure typically ranges between 80 to 120 mmHg. This represents the pressure exerted on the arterial walls during heartbeats, reflecting the force when the heart contracts. Question number 2. Which bone is often referred to as the funny bone? Your options are humerus, radius, ulna, or femur. And the correct answer is A, that is humerus. The humerus bone located in the upper arm is often called the funny bone due to the tingling sensation felt when it is struck. Question number 3. What is the name of the instrument used to measure blood pressure? Your options are thermometer, stethoscope, sphygmomanometer, or ECG machine. The correct answer is sphygmomanometer. A sphygmomanometer is a device used to measure blood pressure. It consists of an inflatable cuff to collapse and then release the artery under the cuff, and a mercury or digital manometer to measure the pressure. Question number 4. Which hormone stimulates the gallbladder to contract and release the bile? Your options are insulin, glucagon, cholecystokinin, or gastrin. The correct answer is C, that is cholecystokinin. CCK is a hormone released by the small intestine that stimulates the gallbladder to contract and release the bile. Question number 5. Which of the following factors can increase blood pressure? Your options are regular exercise, low sodium diet, obesity, or meditation. The correct answer is C, that is obesity. Obesity is associated with an increased risk of high blood pressure due to factors such as insulin resistance, increased sympathetic nervous system activity, and inflammation. Question number 6. What is the term for low blood pressure? Your options: hypertension, hypotension, hyperglycemia, or hyperlipidemia. The correct answer is B, that is hypotension. Hypotension refers to abnormally low blood pressure. It can cause symptoms like dizziness, fainting, fatigue, and may be indicative of underlying health issues. Question number 7. What is the term for the loss of skin color resulting in white or light patches on the skin? Your options: hyperpigmentation, hypopigmentation, erythema, or pallor. The correct answer is hypopigmentation. The hypopigmentation refers to the loss of skin color, leading it to lighter or white patches. Question number 8. Which imaging technique is most commonly used to diagnose gallstones? Your options are MRI, CT scan, ultrasound, or X-ray. The correct answer is C, that is ultrasound. Ultrasound is the most common imaging technique used to detect gallstones due to its effectiveness and non-invasive nature. Question number 9. Which cells are primarily targeted by the human immunodeficiency virus HIV? Your options are T cells, B cells, natural killer cells, or macrophages. The correct answer is A, that is T cells. HIV primarily infects and destroys CD4 plus T cells, weakening the immune system and leading to acquired immunodeficiency syndrome AIDS. Question number 10. What is the term for the force exerted by circulating blood against the walls of blood vessels? Your options are blood flow, cardiac output, blood pressure, or blood viscosity. The correct answer is C, that is blood pressure. Blood pressure is the force exerted by circulating blood against the walls of blood vessels. It is typically measured in millimeters of mercury, mmHg. Question number 11. Which blood vessels carries oxygenated blood away from the heart? The options are pulmonary artery, pulmonary vein, aorta, or vena cava. The correct answer is C, that is aorta. The aorta is the largest artery in the body and carries oxygenated blood from the heart to the rest of the body. Question number 12. Which of the following is not a function of the respiratory system? The options are gas exchange, regulation of pH, digestion, or vocalization. The correct answer is C, that is digestion. The respiratory system is responsible for gas exchange, regulation of pH, and vocalization, but it is not involved in digestion. Question number 13. What is the name of the tube that connects the throat to the stomach? Your options are esophagus, trachea, bronchus, or larynx. The correct answer is A, that is esophagus. The esophagus is a muscular tube that transports food from the throat to the stomach through a series of contractions called peristalsis. Question number 14. Which of the following is not a type of muscle tissue? The options are skeletal, cardiac, nervous, or smooth. The correct answer is C, that is nervous. The muscle tissue includes skeletal, cardiac, and smooth muscles, which are responsible for movement, heart contractions, and organ function respectively. Question number 15. Which structure is responsible for producing insulin? The options are liver, pancreas, gallbladder, or spleen. And the correct answer is B, that is pancreas. The pancreas produces insulin, a hormone that regulates blood sugar levels by facilitating the uptake of glucose into cells. Question number 16. How many floating ribs are in the human body? Your options are 2 pairs, 4 pairs, 3 pairs, or 6 pairs. The correct answer is A, that is 2 pairs. The human body has 2 pairs of floating ribs. That is, those are 11th and 12th pairs, which do not connect to the sternum or the other ribs. Question number 15. Down syndrome is caused by which chromosomal abnormality? Your options are extra copy of chromosome 21, deletion of chromosome 7, extra X chromosome, or mutation in chromosome 14? The correct answer is A, that is extra copy of chromosome 21. The Down syndrome occurs due to trisomy 21, leading to developmental delays and distinctive facial features. Question number 16. Which genetic disorder affects the ability of blood to carry oxygen properly? Your options are cystic fibrosis, sickle cell anemia, hemophilia, or Huntington's disease. The correct answer is B, that is sickle cell anemia. Sickle cell anemia causes red blood cells to become crescent shaped, leading to poor oxygen transport. Question number 17. Which disease is characterized by a loss of memory and cognitive decline? Your options are Parkinson's disease, Alzheimer's disease, epilepsy, or multiple sclerosis. The correct answer is B, that is Alzheimer's disease. Alzheimer's disease is a progressive brain disorder affecting memory and thinking cells. Question number 18. What can happen if a gallstone blocks the common bile duct? Your options are jaundice, increased urination, decreased appetite, weight gain. The correct answer is A, that is jaundice. If a gallstone blocks the common bile duct, it can cause jaundice, a yellowing of the skin and eyes due to the buildup of bilirubin. Question number 19. Which organ stores bile produced by the liver? The options are gallbladder, pancreas, spleen, or appendix. The correct answer is A, that is gallbladder. The gallbladder stores bile produced by the liver and releases it into the small intestine to aid in the digestion of fats. Question number 20. Which of the following bones is not a part of the axial skeleton? The options are skull, rib cage, vertebrae, or scapula. The correct answer is D, that is scapula. The scapula is the part of the appendicular skeleton, while the axial skeletons consist of the skull, rib cage, and vertebrae. Question number 21. What is the main function of white blood cells? The options are carrying oxygen, fighting infection, clotting blood, or producing antibodies. And the correct answer is B, that is fighting infection. White blood cells or leukocytes are the body's primary defense against infection, pathogens, and foreign invaders. Question number 22. Which of the following is not a part of the central nervous system? The options are brain, spinal cord, peripheral nerves, or retina. The correct answer is C, that is peripheral nerves. The central nervous system consists of the brain and spinal cord, while the peripheral nervous system includes the nerves that extend from the central nervous system to the rest of the body. Question number 23. Which structure connects the kidneys to the bladder? The options are urethra, ureterus, renal arteries, or renal veins. And the correct answer is B, that is ureterus. The ureterus are long, narrow tubes that carry urine from the kidneys to the bladder for storage and eventual elimination. Question number 24. Which of the following is not a function of the integumentary system? The options are regulating blood temperature, producing vitamin D, sensation, or producing hormones. The correct answer is D, that is producing hormones. While the integumentary system plays a role in regulating body temperature, producing vitamin D and sensation, it is not primarily responsible for producing hormones. Question number 25. The bones that make up the fingers are called as carpals, tarsals, metacarpals, or phalanges. The correct answer is D, that is phalanges. Phalanges are the bones that make up the fingers and toes, with each finger having 3 phalanges: proximal, middle, and distal. Question number 26. Which bone articulates with the radius to form the elbow joint? The options are humerus, ulna, carpals, or metacarpals. The correct answer is B, that is ulna. The ulna is one of the 2 bones in the forearm, articulating with the radius and humerus to form the elbow joint. Question number 27. Which skin disease is caused by fungal infection? The options are psoriasis, ringworm, eczema, or vitiligo. The correct answer is B, that is ringworm. Ringworm is a contagious fungal infection that causes red circular rashes on the skin. Question number 28. Which disease causes white patches on the skin due to loss of melanin? Your options are psoriasis, eczema, vitiligo, or dermatitis. The correct answer is C, that is vitiligo. The vitiligo is a skin disorder where melanocytes stop producing melanin, leading to white patches. Question number 29. Which STD is caused by the bacterium Treponema pallidum? The options are gonorrhea, syphilis, HIV/AIDS, or genital herpes. The correct answer is B, that is syphilis. Syphilis is a bacterial STD that progresses in stages and can cause serious complication if untreated. Question number 30. Which viral infection is the primary cause of AIDS? Your options are hepatitis B, HPV, HIV, or herpes simplex. The correct answer is C, that is HIV. HIV, human immunodeficiency virus, weakens the immune system, leading to AIDS, that is acquired immunodeficiency syndrome. Question number 31. Which disease causes weak and brittle bones due to calcium loss? Osteoarthritis, osteoporosis, rickets, or scurvy? The correct answer is B, that is osteoporosis. Osteoporosis leads to fragile bones due to decreased bone density, increasing the risk of fractures. Question number 32. Rickets is caused by a deficiency of which vitamin? Your options are vitamin A, vitamin B12, vitamin C, or vitamin D. The correct answer is D, that is vitamin D. Rickets lead to weak, soft bones in children due to insufficient vitamin D, which helps absorb calcium. Question number 33. What type of arthritis is an autoimmune disorder? Your options are osteoarthritis, rheumatoid arthritis, gut, or psoriatic arthritis. The correct answer is B, that is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease that causes inflammation of joints and chronic pain. Question number 34. Cataracts affect which part of the eye? Your options are retina, cornea, lens, or optic nerve. The correct answer is C, that is lens. Cataracts cause clouding of the eye's lens, leading to blurry vision and eventual blindness if untreated. Question number 35. What is the leading cause of blindness worldwide? Your options are glaucoma, cataracts, macular degeneration, or retinopathy. The correct answer is B, that is cataracts. Cataracts cause progressive vision loss due to protein buildup in the eye's lens. Question number 36. What is the term for kidney inflammation? Your options are nephritis, nephrosis, uremia, or glomerulonephritis. The correct answer is A, that is nephritis. Nephritis is kidney inflammation, often caused by infection or autoimmune conditions. Question number 37. Kidney stones are primarily made of which substance? Your options are uric acid, calcium oxalate, sodium chloride, or phosphorus. The correct answer is B, that is calcium oxalate. Kidney stones form when calcium oxalate crystals accumulate in the kidneys, causing pain and urinary issues. Question number 38. Which liver disease is commonly caused by excessive alcohol consumption? Your options are cirrhosis, hepatitis C, fatty liver disease, or jaundice. The correct answer is A, that is cirrhosis. Cirrhosis leads to permanent liver damage and scarring due to long-term alcohol abuse or hepatitis infection. Question number 39. Fatty liver disease is caused by an excess of which substance? Your options are protein, sugar, fat, or carbohydrates. The correct answer is C, that is fat. Fatty liver disease occurs when too much fat buildups in the liver, leading to inflammation and damage. Question number 40. Lupus is an autoimmune disease that affects which part of the body? Your options are skin, joints, organs, or all of the above. The correct answer is D, that is all of the above. Lupus is a chronic autoimmune disease that causes inflammation in the skin, joints and the organs. Question number 41. The tibial nerve runs through which compartment of the leg? Your options are anterior compartment, posterior compartment, lateral compartment or medial compartment. The correct answer is B, that is posterior compartment. The tibial nerve innervates the muscles in the posterior compartment of the leg. Question number 42. Which bone forms the heel of the foot? Your options are talus, calcaneus, cuboid or navicular. The correct answer is B, that is calcaneus. The calcaneus is the largest tarsal bone and forms the heel. Question number 43. The pes anserinus is a common insertion for all except sartorius, gracilis, semitendinosus or biceps femoris. The correct answer is B, that is biceps femoris. The biceps femoris inserts on the fibular head, not at the pes anserinus on the tibia. Question number 44. Which organ produces insulin to regulate blood sugar levels? Your options: liver, pancreas, gallbladder or spleen. The correct answer is B, that is pancreas. The pancreas produces insulin, a hormone that regulates blood sugar levels by facilitating the uptake of glucose into cells. Question number 45. Which of the following is not a function of the respiratory system? Your options are gas exchange, regulation of pH, digestion or vocalization. The correct answer is C, that is digestion. The respiratory system responsible for the gas exchange, regulation of pH and vocalization, but it is not involved in digestion. Question number 46. What is the name of the tube that connects the throat to the stomach? Your options are esophagus, trachea, bronchus or larynx. The correct answer is A, that is esophagus. The esophagus is the muscular tube that transports food from the throat to the stomach through a series of contractions called peristalsis. Question number 47. If a mother is Rh negative and the father is Rh positive, then what is the chance of their baby will be Rh positive? The options are 0%, 25%, 50% or 100%. The correct answer is C, that is 50%. If one parent is Rh positive and the other is Rh negative, then the baby has a 50% chance of inheriting the Rh positive allele from the Rh positive parent. Question number 47. Which of the following blood type has no A, B or Rh antigens? Your options are O positive, A negative, B negative or O negative. The correct answer is D, that is O negative. O negative is the universal donor because it lacks A, B and Rh antigens, which prevents immune reactions when transfused into recipients of any blood type. Question number 48. A person with blood type A can donate to which of the following blood types? Your options are A negative and O negative, A negative and AB negative, O negative and AB positive, or A positive and B negative. The correct answer is B, that is A negative and AB negative. A negative blood can be donated to individuals with A negative and AB negative blood types, as they share the A antigen and lack the Rh factor. Question number 49. What is the common symptom of an aortic aneurysm? Your options are headache, chest pain, abdominal pain, or fatigue. The correct answer is C, that is abdominal pain. Aortic aneurysms often cause abdominal pain as they enlarge and press against surrounding tissue and organs. Question number 40. What diagnostic tool is used to monitor the size of an aortic aneurysm? Your options are blood test, X-ray, ultrasound, or ECG. The correct answer is C, that is ultrasound. Ultrasound is commonly used to visualize and measure the size of an aortic aneurysm over time. So friends, it's the time to comment your score. So comment below your score that you done correctly. And if the video was helpful, then please do like, subscribe and share this video to everyone who are preparing for upcoming exams. And do support us by liking and subscribing and sharing our channel, our videos. So thank you so much for watching and wish you good luck for your upcoming exams.